we learn in medical school and physio school, we should not do anything to create pain, but to find the source and to be able to help the patient. That's why they come to us, is you need to do this. Otherwise, he will not be satisfied or use his money or whatever. So I will start to use anti-inflammatory devices. This one is called P240, it's a low frequency device. And I will start to apply it, in this case, in the lower end of the tendons. Then I will start to apply it on the upper end of the adductors. So I will try to treat all this area before I start to check the backside. So I follow the sartorius here. I put, this is a positive. So this is actually the outgoing frequency. This is the one that creates the collaboration and examine and check what resources do we have present here. But this will never work alone. Then I can use it alone, but it can only stimulate very, very few different neurons and absolutely not creating any resources. So we need a return frequency, a frequency that confirm what I want to do. And for that, I use one that is called negative. This one is P-9. So this is a negative frequency. So when we talk about the nerve system, you can talk about receptors and all of this. This is actually the one is creating the return frequency. And this is where the magic is happening. So I'm going to follow here one of the nerves here and also the tendons. I put the negative here. I want to cover as big area as possible in this case. And I put this one here where we have sartorius go up. So now we have 2 positive and 2 negative. What happens here? The positive is releasing the active frequency. This is the one that do everything. So to explain how this works, when you have a patient with phantom pain, for example, it's when the outgoing frequency is sending massively frequencies to try to get the confirmation, everything is okay, don't worry, you can walk. When the return frequency is not there, it will create immune response. It's called inflammatory response and create an active inflammation. That's why these people with amputation feel the pain. So when we treat them, we do exactly the same. Because the nerve system doesn't have a brain. It doesn't understand the leg is gone. So we need to use the negative. So what I do now, now I forgot to tell you, you can see already the swollenness is more or less. Now it's very loose. Is the pain less or the same?
It's less.
Yeah. But
it's still pain.
It's still pain?
Yeah.
Okay. So what I need to do now, I need to apply resources. As you heard on the introduction video, I will use the one we call ADL. This is glutathione. And this is stimulating the frequency for glutathione. So this is actually now I take control over this area and apply a device that is actually moving glutathione here to destroy the free radicals that create the problem. So I'm going to apply that. And this one I apply where I see the swollenness is worse, right here. And normally we say you should wait 10-15 minutes, fill the patient with water before re-examination. I have very big patients, so I wait 5 seconds. How is it now?
I feel pain, but less.
Less. So this start work now, and then I need to use another antioxidant. In this case, I use carnosine. And carnosine, as you heard on the video, is the body's anabolic natural steroid. This is a massive thing when it comes to cell dividing, renewing cells, remove lactic acid, and then many other features that is happening during the inflammatory state. So I will apply that here because I want the cells to be renewed as fast as possible for the ability to heal the injury. So I'm treating here just a small part of his main injury, and I will also treat the upper part. Then I will use another one that we call MC. This is to remove the stress in the area. So this is actually the exact frequency of medical cannabis to calm down the neurological stress so the other devices can do their work 100% properly. And this one I apply under here. So what is interesting here now, when you work with this, you always need to think, how do I want the frequency to work? So this is working together with this, but this is also working together with the others. So we're creating a lot of triangles here. And now you can see the edema, it was like a little mountain, it's getting less and less. So now he's a little bit scared of my hands. So I'm checking the tissue again in between. Now this is 200% more pressure than before. How does it feel now?
I feel the pressure, but even before I can't handle nothing there.
So you don't feel the same pain?
No.
Okay. If I want, I can be nasty now. I can remove this to see how fast this works. So just for you guys to understand the power of this, I just take this anti-inflammatory off. Let the leg rest. I keep the antioxidants. Just let it rest. Now you can see the edema comes back. Because now all the BRCA negative lymphocytes is getting active again. And I do this minimal pressure. So you can see I can have control over his life as well. So this is I'm just touching. Compare before what I could rub him, but I'm a nice guy, so I will put it on again. So I put it the same on back again. Because this is actually what is so amazing with this also these devices is for healthcare and medical professionals, and you need to have university degree and you need to have examination to be able to enter our school. So to learn how to use it. This looks very, very simple, but it's probably one of the most advanced devices and the only one that can create fusion between cells because the frequency is so different. So I wait. Now we pretend it's gone 10 minutes, but it's only 10 seconds. So I will push. Are you ready?
Mm-hmm.
Sure?
Yeah.
How is it now?
I don't have really pain.
So this is how it is. But I want him to be really happy, so I'm going to check the doctors. I isolated this injury, but when we want the patient to get really, really much better, we need to think the big picture. And we remember this, and that is a lot of pain. So I will remove these two. So here I will isolate the adductors here. So I put one here. I just follow how they work, two positive. And because I have this here, I can actually use this positive to work with this negative, but I actually want to isolate it because when you have this injury, and he probably twisted, he extended, it being a lot of rotation, I want actually this negative to be right over the other one, because these two negative will not interfere with each other, and they cannot talk to each other because they're same frequency. So that means this is isolated, now I isolate this. I will do the same here. I use the AGL device to remove the free radicals as high up as possible. But here I do it different. I use the neurological anti-stress device in the middle. And then I put in the carnosine, the cell divider and renewer, right over the negative. Then, because we don't have all day, so I cannot wait 10 minutes, so I wait 10 seconds. And we're going to check again. So I'm going to use the knife. Oh, you're afraid of my hand?
Yeah, I'm afraid.
So, as you saw before, I could not really create any pressure. Now,
I don't have pain.
So no pain. So we're going to check the other leg as well, because this one was worse, right?
Yes.
So we're going to do the same here. We start with, because here we can see, I don't know if you can see on camera, that you have vessels and veins here that actually tells me it's an injury here, and which could be the problem. So I'm going to do the same, and this is severe pain as well. Yeah, exactly the same. So now I can, it's also important for us as professionals to try to put the picture in the head, how this is action happened, how did he fall, what happened, he passed out, what happened during that time, to actually understand where to start the examination. So we do the same here. Okay, so here we have tendon that is really, really bad. Same here. So as you can see, with little bit of touch, you cannot lie still really. I will also check around the patella here, so I don't have any development of patellofemoral syndrome. And here is also a little bit crunchy. We check the fat pads here. And this is really painful as well. The patella tendon, I move up and down, and this is also bad. So here is a little bit different. So this explains his pain here is worse than the other leg. And we check underneath here again. Check the lymphatic here. And this is not nice either. So we're going to do the lymph also on the back, both legs, but that we do when we move the patient to the stomach. So I'm going to do for this injury here the same. I put the positives here and one here. So I try to cover all these tendons. I'm going to now also treat this PFS problem here. So I'm going to put the positive right under the patella, on the tendon, 50% on and 50% off. I put another one on this side here, positive. So I'm going to do a cross here because I want to hit the frequency under the patella to touch any kind of frequency and inflammation, sorry, that is actually under the cap. I'm going to apply these negatives here. You see I follow here. Actually, the nerve system after exam tells me everything. So when I examine, it will create contractions so I can actually visually see the injuries. Like here. So I'm going to do the cross over the patella here. And here. Like this. Okay. And then on the PFS here, I'm going to put the anti-stress here, right in the center, because I can feel it's also swollen behind the cap. So it starts to develop a negative thing that can be so developing arthritis or any other main problem later. I do the same here. I use the glutathione here. I use the carnosine for renewing of cells so the tissue can start healing. And this process starts immediately. So this device is active for 72 hours. So during this time, the patient needs to drink a lot of water to stay hydrated. So all of these devices here now do different things in different areas. And this is what is so nice with this also, is that we can treat multiple problems at the same time. Okay, so we're going to try this. Are you ready? Now I pressure, my thumb is white. How does it feel?
I feel the pressure, but not really.
Good. We try this here. How is it now?
Yeah, a little pain, but much less.
Much less. And this is in seconds, eh? It's weird, huh?
Yeah, it's strange.
Okay. I'm going to check his adductor on this side too. So you see, he's not happy here either. So probably he could have landed with a split and stretch all kind of direction with the legs, because this injury looks like rotation, stretch, and anterior overstretch. It's actually quite bad. I can see here also that it is some issues. And this is, luckily for him, he's very athletic and trained, so his body's strong. If he wouldn't be that with this accident, he would probably end up in a big casket in the hospital. So I do the same. I isolate the adductors here. Put the negative here. Remove free radicals at the top. removing the stress in the injury in the center, and then renewing the cells right over the negative. Because if this inflammation that is so bad, I would say this is 9 out of 10, don't go away, don't do anything about it. He will start to compensate and walk weird, he will develop hip problems, probably develop lower back pain, sorry, and other issues, and that can take a year, it can take 6 months, but he will get a lot of problems. Because this is how the body works and compensate for anything. Okay, I will check the doctors again. And now with some more pressure, are you ready? How is it now?
Feel pressure, but not really.
But no pain? It's good. We never let ever a patient go out with that, then they have less than 50% of pain reduction. So if you turn over to your stomach, I will check the backside of your legs.
Thank you.
Yeah. So here I'm looking for if it's any other injuries that is visual for me. I examine here, we have one of our main lymphatic nodes right in the middle of the joint in front of the ACL and everything. So I'm going to check that again. As you can see, it's quite painful. So I'm going to do the same. I'm going to treat that as well. Because for me, it's really, really important that we are perfectionistic, that we think of everything, because this is what healthcare is all about, is to put the patient in the center and be able to explain what's going on. So I put a positive here, right over the joint line, so it doesn't cut, because even if the device is very, very thin, it's still of carbonized metal, and that means it can cut easily. So make sure you don't put it right in the joint. We're going to apply this negative very close over, because I want them to work very close on this area. Because if the lymphatic node here is full of inflammation, that is also helping with the immune response to remove B cells and T cells and NK cells, and actually creating the antibodies for helping heal. If that is on fire, it cannot fix the issue and help the other immune response that we have for healing process. It will prevent it. Because the nerve system, the cardiovascular system, and the lymphatic system, the 3 musketeers of the human body, is working as one. And they need each other because they cannot live alone. And I do the same on this side. I forgot to tell you guys, you could see before that this was like a big bump, and you can see with visually that it's actually reducing. This is how fast it works. I mean, it's quite amazing. So I'm going to bend, I use my thumb just to show you guys with how much pressure I can put without he jumping, if you remember from before. So, because the body is so amazing, if you don't have any inflammation or pain, it can take a lot. And that's what we're teaching. We can see medical professors that come in here, neurological specialists, physiotherapists, osteopaths, everyone that comes here to do a clinical examination and understand that you can actually go in between and feel and find everything and use your hands. It's gone. I mean, in the old days, it was the only thing you could do. But we use electronic devices because maybe we are lazy, but it's many things you can't see. And this we will also see on the other patient later. That is a typical thing, that when you don't find the source, it can also be a big issue for the patient. He had pain by doing rotations. How's this feeling? Not so much? Good. Because this is extreme for your injury, right? And this one?
No pain.
No pain? Good. Okay.